One of the most common diseases in the mouth is what we call periodontal disease. It's a disease of the gum and bone around the teeth, not the teeth themselves. So you can have perfectly healthy teeth. No cavities, no fractures, no wear, and even white and beautiful. But with periodontal disease, that tooth can be, or those teeth can be lost. What is periodontal disease? Okay, this is a demonstration of somebody in their early 20s. The disease right now hasn't got any effect on in the mouth. And what you're seeing is the transparency of teeth anchored in bone with gums on top of it. If we take, if you look at the picture here, you'll see that most of the tooth is actually the root anchored in bone. If we take this tooth and cut it in half, you get this image. This is the crown of the tooth. This is the part that's above the gum. This is the root anchored in bone, and the gum going on top of it. From where the gum starts, where it actually physically meets the tooth, there's a little pockets all the way around the tooth. Now, that pocket is how you and I would differ. Not only how we brush it and floss it and go to the dentist to get to areas we cannot get to, but also genetic plays a big factor. Some people hardly brush or floss, and yet they have no problem with the disease. They have no buildup. Very few of them. Most of us have to brush and floss, and some of us do it several times a day, and we still are challenged by the disease. Initially, when the buildup occurs, the gum get irritated and they bleed easily. That's called gingivitis, and that's actually reversible. However, if the plaque stays there long enough with the bacteria, the infection spreads to the bone. And when it spreads to the bone starts dissolving away. And as the bone dissolves away, this pocket that initially was 2 to 3 millimeters is very tiny, becomes deeper. The deeper it becomes, the more food trap occurs, the more bacteria traps in there, and the more damage that occurs in the bone. So it's a vicious cycle, keep feeding upon itself. This process can continue until there is no more bone around the tooth. The problem with the disease is twofold. Number one, it's silent. There is no pain. People maybe have some bleeding upon flossing and brushing, but there's no pain associated with this. So they don't even know something is going on in their mouth until the tooth is loose. And that's where the second problem is. I cannot fix it. We don't have the technology to bring this bone back up again. So once it's gone, it's gone. So what's the treatment? What can we do? Well, the only thing really we can do is prevent further damage. So prevention. And how we do that? By first doing what we call a deep cleaning. And that is getting the jaw numb so a patient is comfortable. And then we go below the gum and clean all the buildup that's occurred over the years. By doing so, the gums become healthier and the pocket becomes smaller where it can be maintained by the patient. Now that is only the first step, the deep cleaning. The patient has to maintain a good oral hygiene at home and regular cleaning thereafter, maybe every 3 to 4 months to come in for a cleaning. But that would be regular cleanings. But that's how we can maintain and control this disease.